Welcome to Medical Mysteries Investigated, where we have investigated the issue of why hip replacement implants sit proud even when the implant is designed to fit line to line with the broach. I know this isn't a common topic for the general population, but since I just finished a video on osteoporosis, it is fresh in my mind. This topic was first posed to a design team meeting I was in a few years ago. With the multiple surgeons and engineers we had in the meeting, the team couldn't come up with an answer. It hasn't been until recently, when I was reviewing sawbones from a Broach study I conducted, that the answer came to me. So let's get into it. Stems sitting proud is a common occurrence in total hip replacement surgeries. It is even more frequent in the tri-wedge design, and I say that generically, style stems for reasons I will get into later. Though some companies design an interference fit of the implant to the broached cavity in the femur, this video explains why that might not be necessary. Factors that play into key components to this issue include bone quality and porosity. Number 2, the implant coating material, i.e., the more coarse the coating, the more likely it will be to cause resistance of the implants with the femoral cavity. Number 3, broach sharpness and newness. A broach that is sharp will cut the cavity in the femur more accurately, whereas an older broach may become worn and cut the cavity smaller than expected. Number 4, force impact from each surgeon is different. So a surgeon that prefers using more forceful blows is less likely to perceive the issue and simply hammer the stem deeper into the cavity. This phenomena of stems sitting proud is even true of implants with a line-to-line fit with the broach. Why does this happen? The broach and implant should be at the same level, right? Let's investigate deeper. As shown by this overlay of broach and stem, the implant material lines up exactly with the cutting edge of each broach tooth. This picture from a company's surgical technique shows the cancellous bone of the femoral cavity in contact with the broach. However, this is not accurate to what is actually happening. The broach teeth cut along the axis shown, which is the axis of impact with the broach handle. Now, let's make a detailed assessment of the individual broach tooth cutting pattern with the femoral cavity. The red in this image represents the femoral cavity. The vertical red lines show the cutting path of each tooth. As you can see, the cut bone is always superior to the tooth that cut the pattern. Also, the triangle shape was left unfilled to show the implant. As shown, the line-to-line principle of the design is being violated. Each red outlined triangle with pink implant material is showing interference area between the broach cavity and the implant. In order for this interference not to occur, the implant must sit proud the height of one tooth pitch. Knowing that each manufacturer has different tooth pitch for their broaches, the exact distance of the broach sitting proud depends on the THR system. The THR system company can minimize this condition by making the broach teeth as close together as possible. Or they can compensate and make the offset of the broach design, knowing this will occur. If you are a surgeon or an implant designer that has come across this issue, please like, subscribe, and comment to this video, and forward it to any of your colleagues that also may be interested. Your comments are greatly appreciated. In conclusion, without additional impacting, the implant will sit proud from the desired broach location in the case of a line-to-line fit designed THR system. To help guide the surgeon to compensate for this issue, oftentimes there are parallel lines to the face of the broach that the surgeon can use to guide his approach or the depth of his broach. Also, this condition will also occur in other implant surgeries with tapered designs, like this total knee replacement system and this total shoulder replacement system. Thank you for watching, and I appreciate your comments below.